All right, Dr. Ulfat is helping you. So
Okay.
if both of you are ready, I'm starting the timer. Yes,
Okay.
here is the question.
Yes, ma'am.
Yeah, indeed.
Right, so if you've read and understood, kindly begin your history taking.
Okay. Hello, I am Mohammed Al Ayan, one of the exam candidate. I confirm your name and age, please.
I'm
Hello.
Susan. I'm 53 years old.
Good.
I confirm your name
Susan,
and age,
I'm
please.
53 years old.
Nice to meet you, Mrs.
I'm
With
Susan,
you.
and I'm
Today,
53.
Yes.
nice to meet you. Today I have been asked to ask you a few questions regarding your condition. Are you okay?
Yes, sure.
Okay. Would you please tell me about your headache?
Actually, doctor, it has, I have this severe headache. After I had a fall, I lost conscious, I became unconscious, and then my husband actually brought me here. I suddenly became
Okay.
unconscious, and then I regained my consciousness, and since then I've been having this severe headache. So could you please tell me
Okay.
what this
Where?
is?
Yes. Dr. Mohammed, I can't hear you. Yes, please.
Hello, Dr. Mohammed?
Not audible, ma'am.
I can't hear you.
I can't hear him either. No, he's not even talking.
Maybe he's
There's no.
disconnecting.
Hello?
Dr.
Yes,
Mohammed,
ma'am.
Dr. Mohammed, can't hear you. Speak louder. Please. Oh, he got disconnected. Dr. Abhishek.
Oh, he
Or
left.
someone can, yes, continue.
Yes, he got disconnected.
Can anyone?
Can I
Dr.
know?
Male? Yes, anyone? Yes,
Can
please.
I do it?
All right. Yes, please. Go
Yeah,
ahead.
Dr. Moish, please.
Please ask. Continue.
Okay, so shall I start from the beginning so I can do it quickly?
Go ahead. Yes, go ahead.
It's okay. Yes.
Hello, my name is Mavish. I'm one of the surgical candidates today.
Yes.
Can I confirm your name, please? Name and age, please.
My name, and I'm 53 years old.
Nice to meet you, Susan. Can you tell me what happened today?
Well, actually, my husband brought me here. I have this severe headache. I just lost suddenly consciousness, and then my husband brought me here, and I regained consciousness. And since then, I've been having the severe headache.
Okay, I'm really sorry to. Can you please tell me where is the headache? Whereabouts is the headache?
Actually, it's all over my head right now. There isn't any specific place I could identify and tell you.
And how it started? Did it started all of a sudden, or did it was it there before as well?
It just happened all of a sudden. I just lost consciousness, and then I told you I gained my consciousness back, and then I have this severe headache since then.
Okay. Okay. So
Yes.
okay.
Ask
So
about the character. Yes.
okay. So can you tell me how is the headache? Can you tell me what how it feels like? Is it like a throbbing headache, or is it like somebody is like is stabbing you something? How is it?
It feels like someone's taking my brain and just shaking it.
Okay. And is this pain going anywhere else?
No, it is all over my head right now. It isn't going anywhere else.
Okay. And is there anything that is making it better?
This
Yes.
pain, and I've nothing I've tried isn't improving this.
Okay. And are you still in a lot of pain at the moment?
Yes, I am actually
Do you want me to give
in
you
a
some
lot of
pain?
pain.
Do you want me to give you some painkillers?
I think yes, it would be better, but I'll take that after I'm done talking to
Okay.
you, I guess.
Okay. So coming back, is there anything that is making it worse, like sitting up or laying down? Anything which make this pain worse?
No,
Okay. And
well, uh, no, nothing is actually exaggerating it.
okay. And when you had this pain, is
Yes.
there any particular time that you had this pain, or is the first time you had this pain?
Well, this is the first time ever I had this headache. Normally we do get headache, but this is the first time I lost consciousness. I've never lost consciousness ever, and since then I've been having this severe headache. I have
Okay.
never had this
Okay. So
severe of a
and
headache.
okay. So if I say that 0 is no pain and 10 is the maximum pain, how much would you say the pain at the moment?
About 7 to 8.
Okay. Okay. And you didn't notice this pain, this kind of headache in like a week ago or 2 weeks back, or is this is the first time ever?
This is actually, I told you, I've had headaches. This is
Okay.
like normal headaches anyone would get, but this severity I have never experienced before. It's the first time.
Okay. And did you vomit before you went unconscious?
No, but I did vomit after I regained consciousness. But it was just little. It wasn't so much. I just
Okay.
was yes, and then I vomited a bit.
Okay. I just wanted to ask that when you had this unconscious spell, were you at home or you were outside? And what were you doing? Were you
I, w-
sitting or were standing?
I was at home. I was actually, I don't remember well what I was doing, but I was at home.
Okay. And you didn't feel sweaty or any hallucinations before you had this headache?
No, not, I don't really remember clearly, doctor.
Okay. Okay, fine. And were you having any problem with the light when this headache started after you have regained the consciousness?
I'm sorry, I did not understand what you said.
I mean, is this light bothering you? This light around you?
No, it's fine. I think I'm
Okay.
okay with the light.
Okay.
There is no problem with the light. Yes.
Did you had any fever in the last couple of days?
Fever? Not really, no.
Okay. And any neck pains you noticed?
Neck pain at the moment? No.
Okay.
Just I'm feeling very weak actually,
Okay.
doctor.
Okay. And did anyone notice any fits when you were unconscious or when you regained? Did you had any fits?
No, I did not have any fits.
Okay.
No, I
And
was
when you
just brought here with the unconsciousness. I did not have any. I completely lost all track, and then I came over here, and then they gave me some. They managed me something, and now I've regained after that, and now my headache is there. That's it.
okay, any chance that you have lost any unintentional weight?
No, I
No. And your
I'm
appetite is
fine.
okay?
Yes, it is fine.
And are you feeling any weakness or numbness in any part of your leg?
No, not really.
Okay. Do you have any other medical problems?
I do have. I do. I do take medication for controlling my blood pressure. That's it.
Okay. And you don't have any other medical problems at all?
No, not really.
Okay.
I have. I but the doctor said that I have some problem in my kidney. I don't really know what that is.
Good.
Okay.
Yes.
And any history? By any chance, did you hurt yourself or hit yourself in the last couple of days?
No, not
Okay.
really.
All right. Any other family member have any problems?
Well, I don't remember well, but one of my siblings had a stroke or something because of some I don't know, aneurysm you say in the brain or something. There was bleeding in his hemorrhage in his brain. So yeah, I know that.
I'm really
Otherwise, I
sorry
don't
to
really
hear
know.
this. Um,
Okay,
do you
it's
smoke
fine. No, I don't.
and alcohol?
No.
Okay. What do you think it could be?
I don't know. I told you, I'm not really stressed, doctor. I'm really happy, whatever. And this headache, all of a sudden, and then, I lose all consciousness. I've never experienced this before. So I really want to find a specialist. And I'm a bit scared because you see, I told you, my family, there has been already one case where there was this hemorrhage in the brain. So I'm like very scared. I've seen my sibling suffer very badly, so I'm scared.
Okay, I'm really sorry that your sibling had this. You have to go through with this. What are your expectations from us today?
First, of course, to ward off this severe headache, and then, of course, get a solution to this so that it never happens again.
Okay. So I'll come back to you after discussing it with my consultant, and then we will do the further test for you. Is that okay?
All right, okay. Thank you
Okay.
so much.
Thank you.
Thank you.
Okay. Can you just
So
sum up your history?
So I have seen this 53 years old lady today who was brought into A&E today unconscious, with and she's woken up. She's complaining of sleep, which she says is the worst headache of her life. She has one episode of vomiting with it as well, and she has a history of a kidney problem, which she's not sure what it was, but and a positive family history for subarachnoid hemorrhage. Considering all these findings, my differential for this patient is the subarachnoid hemorrhage due to the aneurysm in the brain. I would also my other differential diagnosis would be if the patient has any brain tumor, any meningitis,
Yes.
patient have migraines or any in trauma in the past.
Okay. How are you planning to manage this patient?
So I will first do the investigations for this patient. Ideally, I would do the baseline routine investigation, including the SR-CRP. Then I will go for the CT head for this patient. And if there is no aneurysm or nothing in the brain that we could find out, then for 12 hours to do a lumbar puncture to see if there is ongoing small bleed. And that will also rule out if the patient has any infection in the brain like meningitis and encephalitis. Then these are the initial investigation I would like to do for this patient.
Okay. So management would be according to
I
ABC
would
manner.
ABCD. So I will
Yes.
start the patient management on the ABCD protocol, and see if the patient needs to be in the resuscitation room or in the for the continuous monitoring. Then I will inform my consultant and inform the neurosurgical team and about it. Then I will start the patient on fluids. Ideally, the patient should have 3 to 4 liters of fluid in 24 hours. Then I start the patient on nimodipine with with laxatives, and then I will the definitive treatment for this patient would be the clipping of the aneurysm, or we can do burr hole or craniectomy. And these, and then the patient needs to be discussed in the neurosurgery MDT.
Yes, good. Thank you. Right. Yes. Who wants to give feedback? Thank you, Dr. Ulfat. It was very good. And Dr. Mavish,
It was
thank
me,
you.
Mavish.
Yes.
Thank
Yeah,
you,
I know.
ma'am.
And Dr. Ulfat was helping you.
Okay.
Yes.
Yeah. I thought.
Yes, good. No, I
I'm
don't
not-
forget. I don't forget. No, I don't make. Very good. Excellent. Yes. Who wants to give them feedback? Dr.
Dr. Ishfaq is asking.
Yes, Dr. Ishfaq. Why would you do borehole in subarachnoid hemorrhage? Yes, Dr.
was written in the notes.
Oh, Dr. Abhishek got disconnected. I was calling him. Yes, please. This is not the answer, right?
I also don't know. I also don't go by it. Ideally, there is no role of burr hole. If you have to drain the blood, ideally
Yes.
craniectomy should be done. But
Yes.
it was written in the notes from which I prepared, so I just said it. I'm not really
No, but
confident
this
in
is
saying
not.
this in actually.
Yeah, in the exam you
Yes,
don't show that. Yes, please.
Yeah.
yes. In SH, it can be managed either by endovascular approach like clipping or open approach. There is no
Yeah.
role of SH.
Yeah.
Like a burr hole, either you can do craniectomy and clip the aneurysm, or you can go for the
Yeah.
endovascular approach and coil the aneurysm. So there will be no point of using this burr hole in this type of.
And sorry, just one more question. Is it depressive craniotomy or craniectomy? Craniectomy. Okay.
Craniotomy is simply
It's just
making a hole.
yes.
Okay.
Then if you are lifting the bone flap up, you are this is craniectomy.
Okay.
It will be craniotomy here.
Okay,
Yes,
good.
yes. If you are making a hole, that is a craniotomy.
So is the answer craniotomy or craniectomy? What's the answer here?
Then if you're taking
Craniotomy.
out the, if you're
Craniotomy. Okay.
if you're taking out a big chunk of bone for decompressive purpose or all these things, it's called craniectomy then.
Yeah.
But for small, for SH purpose, you usually do craniotomy or this endovascular approach.
Mm-hmm.
That depends. That will be too for what at our level.
And also, ma'am, I just want to ask one or two questions about examination.
Yes.
One thing is in general that for the